Hi, I'm Sandy Brunello.
Hi, I'm Dr. Christy Campo. Abigail Brown's not able to join us today. Welcome to our presentation of urine specimen collection in pediatric populations and integrative review.
Accurate diagnosis and treatment of urological conditions in infants and young children requires effective, efficient urine specimen collection. The purpose of this study has shown to review and synthesize current evidence guidelines and best practices for urine specimen collection in infant and young children's populations.
Urine specimen collection methods and UTI diagnosis and management remain challenging for clinicians despite existing clinical guidelines and evidence to guide practice. Invasive collection methods are the gold standard, but innovative methods exist. UTIs are common in children, including a 30% reoccurrence rate, as well as the risk of severe complications like sepsis and renal scarring. Although prophylactic antibiotics are often prescribed, their benefits are uncertain and may contribute to antimicrobial resistance. Gaps in practice should be considered to address the shortcomings in practice.
English language literature sources from 2019 to 2024 were searched using a flexible iterative search strategy. The list of databases and keywords are below. Analysis and synthesis of these articles was conducted. The authors critically reviewed articles for outcomes and themes consistent with the purpose of this study, including current evidence, practice guidelines, and best practices for urine specimen collection in infants and young children, emphasizing the latest research and innovations in the field.
We have 4 slides on the results. So from 5 databases searched, a total of 691 articles were identified, then screened for inclusion criteria. Duplicates were eliminated. Following comprehensive evaluation, a total of 10 articles were included in the review. Articles selected for inclusion were evaluated for quality. You'll be able to see both the table of results and of the quality evaluation at our poster. Synthesis of articles critically reviewed included considerations of both outcomes and themes consistent with the purpose, including current evidence, practice guidelines, and best practices for urine specimen collection in both infants and young children, with an emphasis on the latest research and innovations in the field. 5 main themes emerged through the data analysis, and we'll review each of those 5 next. First, effective and reliable non-invasive techniques of urine collection methods such as bladder stimulation and clean catch urine collection have consistently shown high success rates and quick procedure times. However, despite being effective alternatives, they do not match the quality of results provided by invasive methods, including catheterization, which yield the lowest contamination rates. While non-invasive methods are less painful and more comfortable for infants and children, they tend to have a higher contamination rate compared to catheterization and suprapubic aspiration, which are more invasive but more reliable. Next, non-invasive methods are not only effective, but also time efficient, making them feasible for routine clinical use, particularly in emergency settings where rapid and reliable urine collection is crucial. Flow cytometry is an example that offers a quick and precise technique for diagnosing and minimizing both invasiveness and time.
Techniques like flow cytometry and urethral catheterization provide high sensitivity and specificity, which enhances clinical decision making by reducing both over and under treatment of UTIs through timely and accurate diagnostics. While bladder catheterization and suprapubic aspiration remain the gold standard for reliable UTI diagnosis, non-invasive methods like clean catch urine stimulation technique offer a practical alternative with manageable contamination risks, especially when parents prefer less invasive procedures for their children. Non-invasive techniques significantly reduce pain and discomfort for infants and young children, leading to better physiologic stability and higher parental satisfaction. These methods are particularly important for patient-centered care as they prioritize the comfort and well-being of young patients, especially when compared to more invasive techniques like catheterization.
Excellent. And finally, the need for the literature highlighted significant variations in urine collection practices across different settings and emphasized the urgent need for standardized guidelines to ensure consistent, effective, and age-appropriate urine collection methods. Standardization should include clear guidelines per age range, age-specific protocols can improve diagnostic accuracy and patient outcomes, particularly in pre-toilet trained children. Next, our discussion and findings. The findings of this study reveal that non-invasive urine collection methods, particularly bladder stimulation and clean catch techniques, are both effective and reliable alternatives to traditional invasive methods such as catheterization and suprapubic aspiration. These non-invasive methods demonstrate high success, low contamination levels, and a significant reduction in patient discomfort, making them preferable in many settings. The analysis highlighted the variability in practice across different healthcare settings and countries, emphasizing the need for the development and implementation of standardized guidelines. Such guidelines would help ensure that infants and children receive the most appropriate, most effective, and comfortable care, regardless of the setting of care and treatment.
This study illustrated the potential of novel diagnostic tools like flow cytometry to enhance the accuracy and efficiency of UTI diagnosis. These reduce the risks associated with both UTI over and under treatment. By improving diagnostic precision, these methods support better clinical decision making and contribute to more effective management strategies for pediatric UTIs. Future research should focus on strengthening the quality and design in non invasive methods. Practice guidelines should review non invasive, innovative specimen collection methods to be applied when clinically appropriate.
We have 2 slides of references for your review, and those will be available at our poster presentation. And we thank you much. If you have any questions, you can email using the email address on the screen. Thank you.